Schizoaffective disorder combines symptoms of psychosis with major mood symptoms. A person can experience hallucinations or strong false beliefs while also going through major depression or periods of mania. But one detail matters most. For schizoaffective disorder, psychotic symptoms must also appear during a period when major mood symptoms aren't present. That's one of the ways doctors separate it from bipolar disorder with psychosis or depression with psychotic features. Someone might struggle with severe depression while also hearing or seeing things other people don't. Later, the mood symptoms may fade while the psychosis continues. Because the symptoms overlap so much, getting the right diagnosis can take time. Most people know PTSD can follow a traumatic experience. Complex PTSD is different because it usually develops after long-term or repeated trauma, especially when the person couldn't easily escape the situation. This includes prolonged abuse, violence, neglect, captivity, or repeated trauma in childhood. The effects go beyond flashbacks and nightmares. A person may struggle to control their emotions, feel deeply ashamed or worthless, have trouble trusting people, or carry a harshly negative view of themselves. There's a painful contradiction here too. When the trauma came from other people, relationships become one of the hardest parts of life. The person may want safety and connection while also feeling that getting close to someone is dangerous. Borderline personality disorder can feel like emotions that shift extremely fast and hit with incredible intensity. It affects emotions, relationships, self-image, and behavior. A person might grow very close to someone and see them as wonderful, then suddenly become terrified that the same person is about to leave. Fear of abandonment often becomes a major part of the disorder, and some people react strongly to even small signs of possible rejection. This isn't just being dramatic. People with BPD experience genuine emotional pain that's difficult to control, and some also struggle with self-harm or suicidal thoughts, which makes proper support and treatment especially important. Narcissistic personality disorder is often reduced to one idea: someone who loves themselves too much. The reality is more complicated. A person with NPD may show a strong need for admiration, a sense of being more important than others, difficulty understanding other people's feelings, or an intense reaction to criticism. Their confidence can look very strong from the outside, but underneath it self-esteem is often extremely fragile, and criticism can feel far more threatening than it would to most people. There's also a quieter presentation called vulnerable narcissism, where instead of looking confident and superior, the person seems sensitive, insecure, resentful, or deeply affected by how others see them. What looks like extreme confidence can sometimes hide a very unstable sense of self-worth. Antisocial personality disorder is another condition that's often misunderstood. The name doesn't mean someone who dislikes socializing. It involves a long-term pattern of ignoring or violating other people's rights and social rules, including repeated lying, manipulation, reckless behavior, aggression, breaking laws, or showing little concern for the harm caused to others. Terms like psychopath and sociopath get used casually, but they aren't official diagnoses the way ASPD is. Not everyone with the disorder looks like a criminal. Some appear confident, charming, or successful while still showing serious patterns of manipulation or disregard for others, and the pattern usually begins early, with serious behavior problems in childhood or adolescence. Body dysmorphic disorder isn't simply caring a lot about appearance. It's an intense focus on a perceived flaw, something that may be very minor or invisible to everyone else. It can involve the skin, nose, hair, jaw, body shape, or another feature. The person may spend hours checking mirrors, comparing themselves to others, hiding the disliked area, avoiding photos, or seeking constant reassurance. Some pursue cosmetic procedures believing that changing the feature will finally fix things, but the distress usually doesn't go away, because the real problem isn't the physical feature itself, it's the obsessive way the mind keeps focusing on it. BDD is closely related to obsessive-compulsive disorder, and for some people it consumes huge parts of the day and affects work, relationships, and everyday life. Delusional disorder can be hard to notice because a person may seem completely normal in most areas of life. They can talk, work, make plans, and hold ordinary conversations. But they hold on to one or more very strong beliefs that aren't supported by reality, and they remain convinced those beliefs are true. Someone may believe another person is secretly following them, that a famous person is secretly in love with them, or that they have a serious illness despite clear medical evidence otherwise. The false belief tends to be very specific, and unlike some other psychotic disorders, the person's thinking and behavior outside that belief can stay relatively organized. Because the belief feels completely real to them, simply saying that's not true usually doesn't help. What if your brain could block access to parts of your own memory? That's the idea behind dissociative amnesia. This goes far beyond forgetting where you left your phone. A person can lose access to important personal memories, sometimes tied to traumatic or highly stressful experiences, and the memory loss isn't explained by an ordinary injury or normal forgetfulness. In some cases, a person experiences a dissociative fugue, suddenly traveling or moving somewhere else with limited or no memory of their identity or how they got there. These experiences can be extremely confusing and frightening. The mind sometimes responds to overwhelming experiences by disconnecting from memories that feel too difficult to process. Have you ever felt disconnected from yourself, almost like you're watching your own life from the outside? That's close to depersonalization. Derealization is slightly different. It's when the world around you feels unreal, distant, flat, or strangely unfamiliar. Some people experience both. What's interesting is that the person usually knows something feels wrong. They don't believe the world has literally changed. They know the experience comes from their own perception, but they still can't switch it off. These symptoms can appear during intense stress, anxiety, panic, or after trauma, creating a strange mix of feeling emotionally disconnected while also becoming frightened by that very feeling. Imagine someone suddenly developing weakness, trouble walking, shaking, vision problems, or seizure-like episodes. Doctors run tests but don't find the structural damage that would normally explain those symptoms. This can happen with functional neurological disorder, or FND. The symptoms are real, and the person isn't pretending. The problem lies in how the brain sends and processes signals rather than invisible damage to the body's physical structure. Symptoms can include weakness, movement problems, sensory changes, speech difficulties, or seizure-like episodes. The key thing to understand is that no structural damage doesn't mean nothing is wrong. The brain and nervous system can malfunction even when scans look clean. Factitious disorder is another widely misunderstood condition. A person with this disorder may deliberately create, exaggerate, or fake medical symptoms, not for money or to avoid responsibility, but because they want to take on the role of a patient and receive medical care and attention. In severe cases, someone may make themselves sick, interfere with medical tests, or cause injuries, leading to repeated hospital visits and unnecessary procedures. There's also a particularly serious form called factitious disorder imposed on another, where someone creates or exaggerates illness in another person, sometimes a child, to receive attention or sympathy as the caregiver. It's a dangerous form of abuse that can put the other person's life at risk. Not everything on this list is a psychiatric disorder. Borderline intellectual functioning describes cognitive ability that falls below average but doesn't meet the criteria for intellectual disability. A person may handle many everyday tasks fine but struggle significantly with complicated paperwork, abstract ideas, fast instructions, or complex problem solving. This creates a frustrating gap. They may not qualify for certain disability services, yet everyday demands are still much harder for them than for most people. Because their difficulties aren't always visible, others may wrongly assume they're lazy or careless, when in reality they're often working extremely hard just to keep up with things other people find easy. Avoidant personality disorder is more than being shy. A person with this condition may strongly want friendships and close relationships while also being deeply afraid of criticism, embarrassment, rejection, or judgment. So they avoid situations where they might be evaluated, which can mean avoiding jobs, social events, dating, friendships, or even ordinary conversations. They want connection badly, but fear tells them that getting close will eventually lead to rejection. The result becomes a cycle. They avoid people because they expect rejection, then grow lonelier because they're avoiding people, and that loneliness reinforces the belief that nobody wants them. Paranoid personality disorder involves a long-lasting pattern of distrust and suspicion toward others. This isn't simply being cautious. The person may regularly assume others are lying, using them, betraying them, or trying to harm them, even without strong evidence. A harmless comment can feel like an insult, a simple favor can look like a hidden plan, and someone's loyalty may be questioned again and again. This is different from psychosis. The person isn't necessarily hallucinating or losing contact with reality. Instead, they have a deep, persistent pattern of reading other people's actions as threatening or dishonest, which makes relationships extremely difficult. When people eventually pull away because of the constant mistrust, that distance can feel like proof the original suspicion was right. Histrionic personality disorder involves a long-term pattern of intense emotion and a strong need for attention. The person may feel uncomfortable when they aren't the center of attention, becoming highly expressive, dramatic, flirtatious, or emotionally intense to pull attention back toward themselves. Their emotions can shift quickly and are often strongly influenced by the people or situation around them. From the outside they may look extremely confident and expressive, but understanding the person underneath that behavior is much harder. The attention seeking isn't just about wanting to entertain people, it's often part of a deeper pattern in how they experience relationships, emotions, and their own sense of importance. This is what makes mental health so complicated. What you see on the outside isn't always the full story. A person who seems confident may be struggling with deep insecurity. Someone who avoids people may desperately want connection. Someone who appears completely normal may be holding onto a belief they can't let go of. Someone whose symptoms have no obvious physical explanation can still be experiencing very real problems. These conditions aren't personality flaws or choices. They shape how a person experiences emotions, relationships, memories, their own body, and even reality itself. And because so many symptoms overlap, diagnosis is rarely simple. If you recognized yourself or someone you know in any of these descriptions, that doesn't automatically mean you or they have the disorder. Only a qualified mental health professional can properly assess symptoms and give a diagnosis. The human mind is complicated, but understanding these conditions is one step toward replacing fear and stereotypes with something far more useful: knowledge. If you found this explanation helpful, subscribe for more videos where we break down complicated topics in simple language.